Happy mornings, everyone. Thank you, dear Muthu sir and team, and thank you to all the listeners who have spared their valuable time to hear me share my experience amidst this august group of speakers. We are here because we all share the common vision and mission to provide exceptional, uncompromised, personalized, preventive, and therapeutic oral health care through early intervention and prevention. I wish to thank Muthu sir for bestowing me with a topic that resonates with Dr. Nathan's views on sedation. This is one such topic in pediatric dentistry that generates the greatest diversity of opinion and debate rather than the actual and the practical deployment of various forms of sedation in your practice in managing those fearful and anxious pediatric dental patients. Well, through this session, we wish to motivate and provide practitioners with practical deployment strategies to best manage chairside pre-cooperative children. Anyone, and I mean anyone with an amalgamation of MIPD, that's minimally invasive pediatric dentistry, a good teamwork, and the right choice of advanced behavior management techniques can help actually create experiences in children that they will cherish into adulthood, deliver quality dental care, and at the same time instill a positive dental attitude. It's the end of the day, and my father always asks me how my day was. Well, this is how I certify the same, and he seeks immense pleasure in the fact that yes, we as Team Vanilla Smiles could make a difference in a child and their parents' lives. And we are able to deliver that experience only because, besides the basic behavior management techniques, we have in our kitty the advanced behavior management strategies. So, presenting you the topic of the day, managing pre-cooperative children chairside, a myth or a reality? Well, it's a reality for us as we proudly present ourselves as a painless and tearless happy gas center, providing permanent solutions in temporary teeth. So let's close our eyes, let's introspect, and I'm sure deep down all of us are going to feel guilty to have contributed in making this child dread and fear dentistry. We're going to feel guilty of delivering such substandard dental care to these children. Well, we earned a few pennies, but we lost the entire circle of trust of those parents who themselves dread and fear dentistry for their child now. After delivering 7 years of passionate pediatric dentistry, I have come to realize one thing, that quality dental care can only be delivered in stillness. And to achieve that stillness chairside, it's important to have the entire spectrum of the continuum of behavior guidance at your disposal. Well, not every child visiting our practice is going to be like Arya. So we put her on an intensive fluoride regimen, but the mother failed at her home hygiene front and wanted a more definitive care for Arya. Well, since we had nitrous oxide oxygen inhalation sedation at our disposal, we were able to manage Arya chairside without the need of general anesthesia. Let us see how. So I'm sure you all will agree that quality comes with stillness. The second tool that often comes handy is the combination of oral midazolam and nitrous oxide oxygen inhalation sedation. Let us see how. So Agastya is one toddler who is very, very close to our hearts. We see him every 6 months now for his preventive checks. And what we wish to highlight through this case as to how the sedation was upscaled from his basic behavior management techniques to nitrous oxide oxygen inhalation sedation to the combination of oral and noise until his treatment or rather his full mouth rehabilitation was completed, and now we are able to manage him only under nitrous oxide oxygen inhalation sedation at follow-ups.
देखो इन्हें ये है ओस की बूंदें पत्तों की गोद में आसमां से कूदे अंगड़ाई ले फिर करवट बदल कर नाजुक से मोती हंस दे फिसल कर खो न जाए तारे जमीन पर ये तो है सर्दी में धूप की किरणें उतरे जो आंगन को सुनहरा सा करने मन के अंधेरों को रोशन सा कर दे ठिठुरती हथेली की रंगत बदल दे खोना
So, this was the visit wherein we tried attempting a pulpectomy for tooth number 61 and 62, but the treatment could not go to completion because the child could not cope up on the dental chair with just nitrous oxide oxygen inhalation sedation. So the child was playful outside only because his first visit ended on a positive note. And hence we combined oral midazolam along with noise.
I found a love for me. Darling, just dive right in. Follow my lead. Well, I found a girl, beautiful and sweet. Well, I never knew you were the someone waiting for me. 'Cause we were just kids when we fell in love, not knowing what it was. I will not give you up this time. Darling, just kiss me slow. Your heart is all I own, and in your eyes, you're holding mine. Baby, I'm dancing in the dark with you between my arms, barefoot on the grass, listening to our favorite song. When you said you looked a mess, I whispered underneath my breath. And we are still kids, but we're so in love, fighting against all odds. I know we'll be alright this time. Darling, this whole deserve it. Darling, you look perfect. Listening to our favorite song, I have faith in what I see. Now I know I have met an angel in person. She looks perfect. I don't.
And so were the subsequent visits for Agastya as we took the entire case to completion. This is the 6-month follow up, the 12-month follow up, and the 18-month follow up. So, with Yati, we wish to show you the downscale from general anesthesia to oral sedation to now managing just under noise. So let's pledge that we all will create experiences that the child will cherish into adulthood. Let's not give up. Let's keep adding the advanced behavior management tools into our armamentarium and let your work, your passion speak for you. Trust yourself, keep doing good work, and success will follow. Let's give permanent solutions to these temporary teeth. Thank you everyone for your patient listening and thank you for taking the plunge with us today. Anyone wishes to dive deeper are directed humbly to our LMS website, that's www.pedozen.com. Let's create more and more of these happy memories. I bow down to the godliness that dwells in all of you listeners today. Thank you. Thank you everyone for your patient listening.